Assalamualaikum. My name is Tengku Azlani bin Tengku Azman. Today, my group will presenting our presentation's topic which about ethics management. Ethical management can be defined as the set of a moral principle or belief that affect the behavior of employees, which we look future, which how ethics management affects the behavior of employee or frontliner in the issue of the pandemic of coronavirus COVID-19. As simple as the frontliner is very important to practice the ethics management in their life, in build the relationship between the employees and the customer or patient. In the frontliner ethics, the ethics management will ensure that the frontliners will treat the patients according the law and the rules which has been set up by government. In addition, the ethics management also allow them to treat their patient in fairly and the best way they can in preventing this pandemic. And we will move to the next presenter, which is we explain about the issue which we have been choose to be mixed in the ethics management. Thank you.
Hi, my name is Nurshafika bin Ahmad Ramli. Today, I will explain about the incident related to the topic that we have chosen, which is the ethics management. Okay, firstly, United States less prepared for the pandemic of coronavirus than other country is because of United States has lack of health insurance with higher medical costs and also lacks of medical equipment, especially for the frontliner, which is PPE, mask, and also the gowns. And for the citizens of United States, as for Americans who has to struggling to afford the medical costs for treatment or testing to coronavirus, can make them to the point of bankruptcy because it has a higher cost to them to go to medical care. And by avoiding the treatments because of the financial reason could be the main reason the increasing of the cases in COVID-19. Despite the lack of medical insurance and higher medical costs among the citizens, United States also failed to provide the doctor and the nurses enough personal equipment to treat their patient, such as PPE, masks, gowns, and so on. With the lack of those medical equipment for their personal equipment, it also can be threaten their life because of not enough of this personal equipment, and also make it harder for them to decrease the cases because we know the United States has the higher case of these outbreaks of virus, and also from that we can see that the ethics management has a problems in their health system. Other than that, the problems in this ethics management of United States, they also has failed to respond and also don't fully explain the current situation which what their country has to face with these outbreaks of coronavirus, and from that it can make the citizens confused of what they have to do. The government wanted everything back to normal, which is they want the businesses to open back. From that, we can see that the government are choosing economic growth over their public health, which make the country who has which make this country, which is United States, has the worst outbreaks of this virus.
Okay, Assalamualaikum. My name Muhammad Izul Amir bin Muhammad Khalid. So today I will explain about the actors that involved in this issue. First, the actors that directly involved the frontliner itself, because they are the person that directly treat the patient, or the person that in charge to handle the patient of the COVID-19 patient, because they have pushed themselves to make sure that this patient can be recovered from the coronavirus COVID-19. So the next actors we can see is about the management. We can see that there are two sides, which is the management of the government and the management of this hospital. Okay, from the government we can see the management of people, which means the government bind to manage the people, which is we can see in Malaysia or other country. The government take the responsibility to implement the MCO, movement control order, to restriction of movement, to make sure that the people to stay at home, and then to and then from the side of management of hospital, the management of hospital needs to manage their equipment, which is personal protection equipment, PPE, to give to the frontliner enough to make sure that there are no lack of PPE from the hospital itself, in order to handle the patient and to make sure that the virus can be break. Okay, so that's all. So thank you.
Assalamualaikum. My name is Nolana Izzati binti Muhammad Yaakob. I would like to explain about the implications of this incident. So the implications of not having proper PPE is put EMS clinicians at risk. Emergency medical services (EMS) play a vital role in responding to requests for assistance and providing emergency medical treatment and transport for ill persons. EMS and paramedics also need to protect themselves with PPE, investigate symptoms, and report possible outbreak of communicable disease to hospital. By not having improper PPE may put the future patients at risk, because emergency medical service (EMS) is a system that provides emergency medical care involving multiple people and agency. If they are not having access to adequate PPE, they may be one of the group with the highest chances of spreading the virus. The management of the country must ensure the other initiative and way how to resolve these inadequate facilities and medical equipment. Next, the implications of not having proper PPE is put patient at risk. The current guidance from the U.S. Occupational Safety and Health Administration (OSHA) has stated that the healthcare workers must use proper PPE when exposed to a patient with a confirmed or suspected COVID-19. When the healthcare workers not having proper PPE, it will risk to the patients, and the number of patients will increase also. The patient can have infected to other patients or healthcare workers in the hospital. The healthcare workers must protect the patients by wearing PPE when interact with high-risk patients during the time. The healthcare workers should not see the patients without appropriate PPE, because it will quickly become clear that seeing a patient without appropriate PPE result in tremendous harm in a pandemic situation. Without PPE, the healthcare workers will become ill and unable to work, then they can run out of the staff and the patient would suffer. The effort of frontliners to save a single patient would end up harming thousands patients.
Next, the implication of not having enough personal protective equipment or PPE is put the community at risk. As the number of the positive cases in United States increase every day, the PPE equipment is out of stock. The medic worker wear the proper PPE is to prevent the further transmission to them. Why? Because they are most vulnerable group when they are the one that handle the positive cases every day, and if they not wearing the proper attire, they can get the disease easily. Even though there are acts such as Pandemic and All Hazard Preparedness Act that are passed by the Congress in 2006, this is the first time in the history in the United States that drastically increasing the number of positive cases every day. So they are mostly not aware and not cannot adapt with the situation that mostly the hospital and clinics does not have the standard of procedure or SOP. So the next one is cause emotional and moral distress among the medic. This is because they did not have option when they lack of PPE, because when they eventually can help the patient that can recover, they make the patient die because not helping them. Meanwhile, if they're helping the patient without the proper PPE, they can make harm to themselves. Besides, the American Nurse Association (ANA) said that when the nurse feel physically unsafe when they are working, they can refuse to work, and the responsibility of the ethics management is in the question whether they are actually want to help the patient or really want to save their self. That's all.
As conclusions, the ethics management is very important to ensure the employees or frontliner directly responsible toward the job. The frontliners such as doctor, emergency responses, and nurses or medical practice is one of the person who are responsible toward this pandemic and to manage the ethics of management. With the ethics management setup, we can see that these frontliners are carry out their duty without bias when they follows the ethics management or code of conduct provided by government. This situation also influence the behavior of the employees in delivery their service during this crucial time and this pandemic, and it shows that it's a very important to have the ethics management in the organization, which is ethics management influence the behavior of the employees. Thank you. That's all.